It's understandable, though, you may now be concerned about the Johnson & Johnson vaccine. Our reporter Sarah Plake has perspective from a vaccine trial participant.
Patty Ledlow participated in the Johnson & Johnson vaccine trial last December. She found out she did get the vaccine and not a placebo.
My own personal perspective was I would rather take the risk and potentially have some side effects, and I totally understood that I didn't know exactly what would happen, but versus the chance of getting COVID, I thought that the risk around getting a vaccination was lower.
She said she doesn't regret her decision.
That's why I wanted to participate in the trial too, to be able to contribute to that, and they take blood work and continue to study it and refine it and hopefully make more advances.
Many clinics around town, like here at the KCVA, they've had to pivot and start using other forms of the vaccine. They plan to use J&J, but are now using Pfizer instead. They say they have enough for today and their upcoming clinic on Thursday. The VA and other clinics will wait for guidance from the CDC, and it's their understanding that more information will come in a matter of days and weeks.
In the cases that have occurred, none occurred beyond 2 weeks after having received the vaccine. So if you received the vaccine several weeks or months ago, then obviously there's nothing to worry about.
Dr. Mark Steele with Truman Medical Centers says the CDC made their decision out of an abundance of caution.
And I would encourage people not to jump to any conclusions. So we don't know that these cases are directly related to receiving the vaccine or whether or not they're naturally occurring. And so that's some of the information that the FDA and CDC is really going to dig into.
Steele says the CDC's response means the system is working and that safety is number one.
Sarah Blake joining us live. Sarah, have any similar issues been reported with the other two vaccines that are approved for use in the U.S.?
No similar issues have been reported with the Moderna or Pfizer vaccines. And just today we heard from the Biden administration, they still want to make sure that every American adult has access to a vaccine by the end of next month. I'm Sarah Plake, 41 Action News.
May 1 is that goal. Sarah, thank you for that update.